Hi, my name is Margaret Peyton. I'm a Master of Science Nursing student at the University of Arizona, Coverdell Fellow, and a volunteer at Clinica Amistad as part of my outreach assistantship. I'm going to talk to you really briefly about my role at Clinica Amistad and how it relates to the information presented in this poster. So my role at Clinica Amistad is an RN or nurse triage volunteer. My primary responsibility is to address any walk-in clients who come in without an appointment for whatever issue it may be. I review their history and their vital signs from that day, do a quick assessment, talk to them about their current issue, and if anything is urgent, make sure that they see a provider right away. Otherwise, schedule them to see a provider in the future if it is a non-urgent issue. Secondly, I review and authorize refill requests for prescription medications. And lastly, I review lab results that come in for these patients. And they're usually blood tests of some sort. In my first month of doing all of these things at Clinica Amistad, I was starting to notice patterns. Most of the medications that I was authorizing refills for are meant to lower blood pressure or address high blood glucose or diabetes. And most of the abnormal lab results that I saw are lab results that I know are related to, once again, high blood pressure or cholesterol and diabetes. And this data was collected from visit summary forms that providers would fill out after a patient had a visit. And when the data was published, it kind of confirmed what I was seeing in the clinical setting. The three most common diagnoses among our population or our patients were hypertension, diabetes, and dyslipidemia, which is a fancy word for high cholesterol. In terms of demographics, 88% of the patients are Hispanic or Latino, most of them immigrants, and all of them are uninsured, and most of them are also lower income. And so putting the demographic data together with the clinical data that we're seeing with these common diagnoses, it's very consistent with what is seen nationally in terms of health disparities. And this is something that if you are in school for public health or another health science like me in nursing, you'll probably see in your textbooks and literature as well. And these disparities can be explained by something called the social determinants of health, which tells us how a person's income, access to healthcare, access to healthy foods, access to safe spaces to exercise and time to exercise, as well as the effects of chronic stress. All of these factors impact a person's risk for these conditions, as well as the risk for these conditions to worsen and lead to secondary conditions or complications. And it was very interesting to see all of this play out kind of in the microcosm of just one free clinic in the south of Tucson. And it's also really interesting to see how, as a clinic, we address these health disparities by providing free healthcare, free access to lab analysis to make sure we're checking up on these things, and then prescriptions to make sure that these patients do not develop complications of these common conditions. That is all the time that I have, and I thank you for watching.